Hi, in this video we'd like to talk about a delivery method option that some women can consider for their delivery of the child. So today's topic is vaginal birth after cesarean, also known as VBAC. VBAC is also equivalent to TOLAC. TOLAC stands for Trial of Labor After Cesarean. So VBAC is vaginal birth for those who have experienced a history of cesarean section. Now, vaginal birth is usually considered risky for those who have a history of C-sections because the uterus carries a cesarean scar, and during this attempt of a vaginal birth after cesarean, there is a risk of the scar tissue, because it's not smooth muscle tissue, it's connective tissue, so it's not as strong as uterine muscles. So there is a possibility of when the womb expands during labor, causing a tear, then a rupture, and causing some life-threatening complications for the baby and also for the mother. So VBAC is something that is recommended, but sometimes we need to be very careful to who we recommend it to. Now, in many hospitals, when we look at patients with a history of C-sections, we believe that if you have been a C-section before, you are always a C-section patient, regardless of how many patients you have, how many pregnancies you have, you will always go for C-section. But here at Antai Hospital, we believe that a VBAC after a history of C-section is still a very high success rate. But we still recommend it for those patients who seek it, because sometimes vaginal birth is very important for some women to experience, and it is indeed a profound and beautiful experience. But we need to be careful with the quality criteria that we assess before we determine whether or not you have a successful chance. So you can always talk to your doctor, especially here at Antai Hospital. We always recommend our patients to actually talk to us what kind of delivery method do they want. And VBAC is very common for C-section, because statistically we are speaking, C-section is being recommended increasingly over the years. In certain situations where C-sections is not required, but it's also done because it just saves more time and speeds up the labor process. So here at Antai Hospital, VBAC is not only done for our patients, we also incorporate our water birth specialty that we here at Antai Hospital offer as a combined package to increase your chances. Generally speaking, if you have a history of one C-section, you have a very high success rate, almost up to the orders of 90 to 95%. And if you have a history of 2 to 3, you still can have a successful VBAC, but we need to be more careful. And with the addition of water birth, where the mother is submerged inside the pool of water, this increases the chance of success as well, because the mother is more calm, and then the likeliness of a uterine rupture is actually very low, lower than you may think. And then VBAC should be a choice that you can choose in many hospitals. However, VBAC is not an option that you can get in many hospitals, because many doctors are afraid of what might happen. And also it does pose certain risk, but you need the experience and special skills and expertise to actually assess a patient properly. So there is no fancy procedure or extra procedures that you need to do during a VBAC. The entire process is very similar to a normal vaginal birth, but we will be having an emergency C-section team in standby in case of any potential complications. For example, if the umbilical cord has been found to be wrapped around the child, then we need to go into C-section. If the gestational position, the fetal position, is not in a correct place, then we need to go into C-section. And then if the fetus is in distress or is stuck during the cervical dilation, then we need to go into an emergency C-section immediately to protect the mother's life and also the baby's life. But these are all very low risk situations and are unlikely to happen if you follow the correct procedures, and also our doctors here are quite experienced to help you achieve a successful VBAC. To find out more information about VBAC and whether or not you qualify, please visit our website. Also, arrange an online consultation if you'd like to seek delivery here with Antai Hospital.